Are antidepressants truly better at treating depression than psychotherapy? Well, it's helpful to look at a little background at what antidepressants and psychotherapy are anyways and how they are effective differently. Antidepressants are what they sound like. They attempt to counter the effects of depression through chemistry. The most common type of antidepressant prescribed are SSRIs, which are selective serotonin reuptake inhibitors. These allow serotonin to linger in the brain's synapse longer, creating a sense of happiness. The most popular types of SSRIs are fluoxetine, citalopram, sertraline, paroxetine, and escitalopram. In contrast, psychotherapy aims to work at a depressed patient's brain through mental awareness and rewiring. There are different kinds of psychotherapy: humanistic, behavioral, psychoanalysis, and cognitive. Different types of mental illness and disorders benefit from different types of therapy. For example, insight therapies like psychoanalysis and humanistic therapies attempt to improve awareness and reflect on past actions. Or, someone who has self-harmful behavior would be best seeking a cognitive behavioral therapist to evaluate how their thoughts and actions interact. However, given this myth that antidepressants work better than psychotherapy at treating depression, it's helpful to know some background as to where it originated and how it became so popular, further why people keep it around. When you get a headache, it's often first nature to take ibuprofen to ease the pain, or similarly, allergy pills to relieve your allergies. We're socially conditioned to take a pill for our problems and for our pain. This rolls right into the emotional pain as well. When a doctor or a professional offers options to treat depression, why wouldn't you try the pill? It should make you feel better, right? Well, for some people, yes.
There are many cases where antidepressants are shown to work well. For example, there was a study done where 180 adults who were prescribed antidepressants were studied and surveyed. 89.4% of people reported signs of reduced depression while on the antidepressants. Also, 2/3 of the participants reported that they were now able to cope because of the antidepressants. However, even though studies have shown them to work, they are not always that effective, and there are other drawbacks as well. One major problem is the withdrawal symptoms and side effects. In the same study as before, 71.8% of people reported sexual problems, 73.5% reported withdrawal effects, 64.5% reported feeling emotionally numb, 65.3% experienced weight gain, and 43% reported they felt they were addicted.
If you're mildly to moderately depressed, research has shown that you're likely to recover with a variety of methods. In 38 clinical trials with over 3,000 depressed patients, it was concluded that psychotherapy and antidepressant groups have substantial improvement. Similarly, patients in the placebo group also had improved a significant amount. This shows that doing nothing is likely not the best way to respond to depression, although you may experience changes in behavior over time. Research has also found that depression is associated with low cortisol levels, meaning low motivation and lack of sleep. One study observing the relationship between depression and psychotherapy showed that after 14 sessions of cognitive behavioral therapy, depressed patients returned to normal cortisol levels. Additionally, in 15 to 20 sessions, these patients observed significant changes in their Hamilton Depression Rating Score. Even more positively, the experimenters saw an increase in blood flow to the hippocampus, which is associated with warmth, intimacy, personal relationships, and happiness. That said, psychotherapy is a really powerful tool towards rewiring the brain to think in ways it has not been trained to think, or to think in new ways. Psychotherapy is also a powerful tool when it comes to the sustainability of remission, or in other words, how long someone remains stable.
Psychotherapy and antidepressants are both proven to work and be beneficial. However, psychotherapy has better long-term outcomes and is shown to have higher recovery rates because it teaches coping mechanisms and how you deal with real-life situations.
With any depressed patient, psychotherapy should be used, and depending on the severity of the depression, antidepressant medication can be used in combination with therapy in order to gain tools and chemical balance. So, antidepressant medication does not triumph over therapy. Rather, the client's attitude towards both of these situations and the severity of depression shows that the two have similar results, but psychotherapy does display more longevity.